Hello and welcome to Life Challenges, better known as a conversation with Dr. David Klayman. If you've been following our programming, you know that last time we were together, we were talking about a group of people that are working in conjunction with Dr. Klayman. Take it, that you were going to the legislature. You told us as we left that last show to watch the legislature to see if your bill passed.
And funny, we didn't even know what the bill number was when they came.
I was going to say.
So this has been a really interesting odyssey for people that have never worked with the legislature. And when you have an advocate such as Senator Trump and Speaker Hanshaw and the people that we dealt directly with, it has been a very interesting trip. The study committee that we had needed to be continued. It had to be continued by legislation. And we went down and everybody said, yeah, let's do it. And we did it. And
because your committee was new, correct?
It was a year old. We had our first active year last year, and we submitted I don't know if we were here then. We submitted a 180-page report to the legislature. They asked for it. They wanted it on November 30th. We gave it. And I have to once again give the credit to the people that deserve it. Colleen Lillard, who is the clinical forensic director for the state, probably one of the top 5 brightest people I've worked with in my career. John Snyder, who is the forensic coordinator, who is the guy who has been responsible for several years for all these outreach things for group homes and policy formation and stuff like that. He was an incredible font of knowledge. And then a lady named Martha Minter, who is a consultant, who was the person that coordinated all of our 27 meetings with stakeholders.
Wow.
And I'm doing this on purpose because it's not like it's like we just meet and something happens. And Jenny Lancaster, who is a graphics person who put our report together. And so and Jenny and Martha, Colleen, John, and I were on every one of the 27 meetings that we had with stakeholders. Plus we talked and met and did other special interest group stuff. So we were pretty happy with what we did, but I'm going to compare this to something strange in my life. I've got a bug up my butt the same I did as when I first got introduced to hospice. That this study commission has a piece of me right now that was as important to me as hospice has been for the past 50 years, 45 years. We want to do something, and we're not a committee that can establish anything. We're a reporting committee. We to look at things and kind of get a state of the union and give advice to the legislature. Whether they take it or not, we just want to know that we did the right job. And this has been kind of cool. So we finished on November 30th, and it was kind of funny because we would talk, the three of us would talk all the time on anything. It was really kind of wonderful. And we learned a lot. I am now taking, for instance, every single online thing I have with IDD, intellectual and developmental disabilities, and the correction system. I have now I can't remember how many hours I've taken now on, and what we're finding is we did a good job. We understand it as well as anybody in the United States. We may not be implementing yet, but we're right on target. And thanks to the people that wrote the bill originally, we're on target because we use this thing called the strategic intercept model.
So you wrote this report.
Yes, ma'am.
You submitted it to the legislature.
Yep.
And you got your bill passed.
Well, it was interesting because we submitted the report and we didn't hear anything. And I'm going, whoa. So we got a request from the Joint Judiciary. We appeared before them, and that was an interesting presentation. And then we got a request to come and present to the Senate Judiciary only because it was sponsored by the Senate side. And it was, I've been around a lot of this stuff as an observer. It was a wonderful reception. People were almost kept their interest because it's not the most exciting thing to other people, but they were really wonderful. Senator Trump, who's not going to probably be a senator next year. He's going to be in another position. It's good for the state. We had talks, and we met with the legal staff, and some changes came, and one of them is we're going to be expanded the input to our committee, the bill said, so that other pieces of the legislature could call and ask us questions, and we can go out and look for the answers to them. And we created a steering committee of the three of us now that it's officially recognized. And we're adding people on. And we're actually going to have, by law, the President of the Senate and the Speaker of the House shall appoint one of their members to represent the legislature on our committee.
And so this committee is ongoing.
It's going to be now. As of Saturday at sometime in the afternoon, I'm sitting working on a report, and I've got the live shoot from the House of Delegates. No, I guess it had to go to the Senate, back to Senate. Anyway, I'm waiting for it to come out. I'm learning all these new terms like messaging and all this stuff. But so now the committee we're waiting for the governor to sign it, because it can't really be law until the governor signs it.
Right, exactly.
But we are empowered. Our date of being official goes back to the date it was passed.
Right.
So
right.
Immediately. So we're going to meet this week or next week. The steering committee is going to meet. So what happens is it went through a whole bunch of shenanigans. It does. So our committee, to refresh people, had a mandate to try to figure out what to do to divert 4 at-risk populations out of the adjudicatory system. That means if you have somebody who has mental illness or, let's just say, autism, and they get arrested, do you automatically take them to jail? And what we did learn, which would not be a big surprise, is that for all 4 of the groups, IDD, which includes cognitive impairment, traumatic brain injury, anything that, so it wasn't just intellectually and developmentally disabled, which are usually birth trauma early in life. We are also talking about intervening now in the correction system, for instance, and getting one of the things that came out of another piece of legislation, but we think is great. We're going to actually survey all of the people in the prison system over the next couple of years to see how many of them had a TBI and how many of those might have been related to part of their criminal action. Now, it's not as daunting as we think, because we do competency to stand trial and criminal responsibility evaluations, which assess cognitive impairment and the impact of traumatic brain injury. So not all traumatic brain injuries will be the reason why somebody ends up in jail. But we don't have enough treatment for them either. And we don't have enough treatment for cognitive impairment.
So you're wanting to put them in treatment as opposed to incarceration?
Well, we have to be realistic. It's a lot of money. And so,
yeah.
So this year, we have not met, so I'm saying that we're looking at this. What we realize is that the first thing we realize, and I think I said this the last show, is that we are only addressing the 360 people who have connections with the forensic system. Now that is not an accurate number, because we're talking about today. Mm-hmm. I could call up to John and he would tell me how many people are in some level of care who are considered forensic patients, that they've run afoul of the law. They're either at SHARP having competency restoration, which is so they can go to trial.
Right.
And sometimes we have to educate, sometimes we have to medicate, but we're now in this cooperative arrangement with the regional jails, so they don't have to wait all the time to get to SHARP. I mean, there's a lot of good things happening, a lot of interactions. So what our goal this year is to start continue looking at what is going on in the state. What can be duplicated? What can we do for economy of scale, that if there's a program being offered in Clarksburg or Beckley, what can other people do to feed off that and learn from them so that we can implement it in our communities? Mm-hmm. We're going to try to look at what's feasible in each community, because each community has different resources. We're working, so one of our major things is intra-agency cooperation and memorandums of understanding. I love that. And so what we're really looking at is tearing down boundaries and working to be transparent and not have other people want to hide things and us hide things, so that we talk about what's really going on out there and what we can do if we work together. Because our IDD population, our SMI population, seriously mentally ill,
okay,
or the children, because we have juvies as part of our responsibility, because some other law that they sometimes get in trouble and they get put in the juvenile system.
2 14-year-olds, I mean, yes.
So,
yeah.
And they've now made it the Dangerousness Assessment Advisory Board study group. I don't remember how they exactly said. So now the committee that helps the courts determine whether risk assessment's been inappropriate, and then we have appropriate step-down placements for people who have been in the adjudicatory system. How do we prevent them from going in, or what do we do to get them out? Or what do we do to get them out of the hospital if we have to?
So are you doing all of this, the members of the legislature, as they create bills or look at laws, would definitely, you would be a resource?
That is, the intent, I think, is for us to be an independent resource without any particular agenda, except to build on the information that we gather from the community. How's that for a way of saying it?
So if I was a legislator and I had a certain concern in the mental illness area, I would come to you for that research?
Well, only if it has a forensic connection. Now,
Forensic being jail, criminal. Legal.
Now, the neat thing is, and this has been the wonderful part of this, is we have connected with a whole bunch of other people who we've had connections with the IDD network. There's an ECHO group up in Morgantown. God, I'm blocking a name. Anyway, we started attending their meetings. Some representative, I was the representative, and they asked me to do a presentation on IDD from the perspective of forensics and what we have to deal with. So we have really had this. So you have the big population of people that have intellectual and developmental disabilities that never get in trouble with the law.
Right.
And same with the mental illness, and same with everything. But now we have to take a look at this population still is. We have 364 people in our system right now, but how many people have been through before? How many people may come back through again? And so we're looking at recidivism. So we have a prevention thing that we're looking at now to keep people out, to come up with ways to do that. And what do we do when people do go through the system, whether they're in the hospital and found non-competent, not restorable, which means their whole adjudicatory process stops, but can we risk putting them back on the street?
It would seem to me that county government would be very interested.
We're hoping, because we have the one interesting part for us that we laugh, but we're working on it, is we have no fiscal note. We don't have any support. There's no money to support this committee. We're all doing
You're all volunteers.
We get to pay, if we work on it, we get a per diem.
Okay.
But that's it. So we don't have any administrative support at this point. So what we're going to be, we have to go out and we now are allowed to enter into memorandums of understanding for grants, so we can support ourselves if we can find grants. Because one of the goals of the commission or the study group is to find grant sources that can support these approaches to keep people out or help them go back in the community. We've had 4 huge cases. We're on another task force that was grassroots. I mentioned this last time. We meet monthly or so. Mr. Wade is the guy that organized this, but we have a group that does this. We had one last week. We had a huge problem with the guy. We didn't know what to do with him, and we problem solved for an hour. 13 of us were on the phone talking on Zoom. What do we do? And we got a call from Disability Rights of West Virginia to say, based upon the conversation, we were able to take care of it. Everything's working out, and
The first thing I thought of is counties pay the fees for prisoners. So it seems to me they would have a vested interest in.
Well, here's the rub. Money. Okay, so and we don't have exact numbers. This one of the goals this year is to get exact numbers that it costs us at a certain level of care. What we do know is that a patient in the hospital at Sharp, at Bateman, at Clarksburg Highland, and at River Park, and the places that do our overflow, get X amount of dollars a day per patient. If you put them in a secure residential step down, it's half of that, at least half of that. Unfortunately, the jail is the cheapest. Even if we paid the per diem in jail.
The jail is the cheapest?
Yeah, I think so. We're going to, folks, do not.
We'll make a note of that and return to that.
But if you look at what they're charging, it's not $500 a day per inmate or per person in jail. It is not $500 a day, and it was at least that in the other settings, probably less than residential.
Wow.
So there's a cost savings, but we have to put bricks and mortar to place, and then we have to have qualified professionals. I just talked with the Higher Education Policy Commission, who in and of itself has to find a way to keep going for themselves with grants and things. And one of the things we would be saying is that let's just use IDD. If we're going to be working with them and we're going to be doing either prevention or step down, we need people that understand how to work with people with intellectual and developmental disabilities.
Right. So
I just saw a webinar, as participant in a webinar, where a police department, I can't remember where it was, shoot, that's my 70s brain, have trained their officers to control the situation and not control the person, which is interesting because when you approach somebody with an intellectual developmental disability, they often get afraid, panicky, then they act out some more.
Yeah.
So the case study they had a 28-year-old intellectually developmentally disabled person left his treatment facility or his support system and disappeared. Elopement is a big deal with the IDD population. And people knew where he'd go. He'd go to a park, he'd go and sit on a bench. So the cops came, now they had 6 cars, from what they told me, but not visible, just around the park. They sent one officer who has been trained to deal with this, and he walked up, and I'm going to make up a name, Tracy. Are you Tracy? The kid answered yes. He said, I'm not here to cause you any trouble. I just want to make sure you're all right. Are you okay? Yes. Would you like to stay here? Yes. And you could see the situation became calmer. He said, Tracy, your mom's on her way. She'll be here to pick you up. He said, and he doesn't say anything. The mother drives up. He gets in the car and he goes away. No handcuffs, no screaming, no forcible restraint, no nothing. So the line in the thing was, we've learned to control the situation rather than try to control the person. Because if we create the situation in that population with that specific kind of person, you may avoid the kind of escalation. So one of the other things we want to do is have a data system, a database, that would be held by Metro probably. We don't know. This is all fit, please.
Right.
Folks, we're not doing this yet. These are thoughts. But we would like to have a database that says, Sharon King, if she is found on the street, do not approach her from the left side because she's blind in her left eye. Use these, and you would have like the cards they have at Metro where they tell you what to do when they're reading off. Well, we would have the same access to that. So if we know Sharon King has been targeted and picked up, Metro, can you do a search? I'm making this up again, by the way. And we would be able to change the circumstances. We'd know the best way. What medicines have worked for people when they're out of control. We really would love to have stepped.
So you'd have to work with police departments too. I mean, you
Oh.
have to. And that's, I mean, I'm thinking about, I wonder if I'm a policeman, if I resent that over going out and catching a bank robber.
No, I think, Charleston PD and a lot of people, we just got the, Ron English and a couple other people that are working on this got a grant to do emotional intelligence with cops.
Oh, very good.
They got a $900,000 grant. There are groups in every city that are trying to deal with the homeless and dealing with all this other stuff. Now, homeless are not our problem to start, but if they have if they meet in our population designation, then we would be saying, oh, so how do we? This gets so big,
right,
and so what the beauty of this has become is we have this network around the state that has just begun to talk to each other. And one of the things we've learned, if you know the person, you know the name or the face, and you have a problem, you can call.
Yeah.
And if you're a stranger, nobody knows. So if I have an issue now, well, Rodney Miller, who used to be a delegate, who's the executive director of the Deputy Sheriff's Association, I'll be trying to meet with him really soon, and we're going to try to get a law enforcement group together, more than we did last time. We had one meeting with the sheriffs. We didn't do real well with the local cops. But I'm reaching out to the local cops that we work with. We're looking at the state police. We're hospitals, rural access hospitals.
Yeah.
So we have to talk about what we can do with them. The behavioral health centers, how can we actually work as partners with them, or we can't be the partners. How can we recommend alliances, and what would we expect for best practices? Because that's what we're asked to do. What's out there? What's the best practices? What can work?
You're a major advisory board.
We may be. Right now, we're a little advisory board, and we laugh because we had so much stuff going on, and we're so little. There's 18 of us.
While we were in hiatus during the session, there were notes. The Gazette, January 13th, West Virginia ranked the worst state for mental and physical well-being. Forbes Advisor ranked West Virginia as the unhealthiest state in the union. ProPublica reports that 1 in 5 people have mental illness, and that getting help is the issue. Mental illness, in my opinion, mental illness is like the border.
So in the 8 minutes we have left today, actually 7 minutes we have left today.
It's huge.
We are not the only state that sucks.
No, I mean, seriously.
And they rate us badly. Yes, we have a significant problem. We can't deny that. We have to work on changing ethos there where people, even when they're offered help, don't take it.
Right.
That's number one. Number two, we, like almost everywhere in the country, have a lack of mental health professionals. People have to wait a long time to get community help in practices.
You mean the average person?
The average person, even the on-average person. I have my friends calling me and saying I need to get help from my family member, and I don't know the people out there now, a lot of them who are delivering service. So it can't be, hi, this is David. And with my voice, I don't even have to say anything else besides that. People are all busy, and I'm trying to make relationships with some of the practices. That's one of the other things we're going to be working with some of the private sector, because the private sector is never brought into these problem-solving issues. So we've got a lot of work to do. And yes, we have crap in the state right now that is going on, but we have an enormous amount of good stuff. Given the manpower and given the finance that we have, everybody is trying to do the best they can with what they've got. The mental health centers used to get reimbursed for group homes. It was part of the way that things, because we had block grants. Now they don't. And so there's certain behavioral health centers that are doing really well. There's certain that are doing terribly.
But we have a shortage of mental health.
Oh, we have a
behavioral health.
So when I talked to the Higher Education Policy Commission, I said, what can we do to work with you to get it to be on a track that we can start recommending how we can start bringing people in and educating them, so that if you have a high school student who can work as an aide, how do we then finance that person to go get a certificate, an associate's degree? And if they want to go up from that, how do we help them get a master's degree? And how do we put a support system in to make sure that we're giving best standards of care? And that comes from my old man's view that there is a benefit of wisdom in the mental health system. And a couple of us were talking last week. Not everything is one brand of therapy. Not everything is just cookie cutter. But we have to work with the emergency rooms. We have to work with the cops. We have to work with the Mental Hygiene Commission. Now, we don't do it all directly, but we're making those outreaches, prosecuting attorneys, public defenders. I mean, if you could see this group, rehab, we're all talking together on this committee. There's 17 of us, now there's 22, I think, that are listed. What we're doing is we're getting to know each other. It was saying, so, what do you think? Not, here's what you have to do. And we welcome hearing that there's other ideas. We've had input about what we're supposed to do with the TBI population. We've had, is wanted. Now, we don't have the money to do it yet, but we're going to say this. So the part of all of these populations for this year is to define the problems more accurately, I hope, get our numbers, start putting fiscal numbers and saying that if you do this, it would be like, how many times have you driven over the bridge at Oakwood, that area, and you see there's another set of potholes? Yeah. Wouldn't it be lovely? And this is, I'm not saying any of the Department of Highways, I'm just saying, wouldn't it be lovely if we paid 25% more for the surfacing, that we would get 10 more years out of that thing? We wouldn't have to replace them every year. That's what we're into now.
It's like buying thread, clothes. The better the thread, the longer the love.
2008, I bought these pants.
Exactly, exactly.
I just looked at it.
You get what you pay for.
So, I hope my enthusiasm comes through. I have two other people that are equally. Matter of fact, we have about 15 or 20 who are equally enthusiastic. Martha Minter, who was the lady that helped us put the program together. She was on the phone with us all day, Friday and Saturday. Are we through? Are we through yet? And when we came through, it was so anticlimactic, but we're in. Now we just have the governor sign it.
The only thing that worries me is the majority of the legislature is up for real. The whole entire place
We're getting
is
ready
up.
for it.
So you're going to have all new, or a lot of new people
but-
to go. So you've got another job to do
Right.
to reacquaint these people with what you are and who you are.
As chair, one of my hopes is that instead of just the November 30th next year, we're going to keep this legislature in tune, informed. And we're going to reach out to the candidates. And on November, whatever it is, election day, my goal hopefully will be to write all of them and say, hi, when you get here, let's talk. I'm hoping that we're going to be able to get the Dangerousness Assessment Advisory Board more active. We've had very few referrals compared to what we thought we would, but it's partially my long COVID, so I didn't do what I was supposed to do to get some of the letters out. But now, to write to the judiciary, what can we do to help you? Because we've got some wiggle room on what we can do. So our committee is only one of a gazillion other efforts around here, around the state, to do what you're talking about, is raise us up. Changing what you wrote about us being so bad is not just the responsibility of the healthcare system or the mental health system. It's the responsibility of the public to be willing to understand that if they do these things, we will rise up from being judged that badly. I don't think we're as bad that, when people say we're the worst place to live, and that I just saw an article, the worst city in the state was Beckley. That's bull. I mean, every place has its bad stuff and its good stuff. We're going to be careful of the metrics we use, the criteria we use for making judgments. We are just a data collecting, opinion developing, non-affiliated group.
The bottom line is that you're doing something. That when we read the negative reporting that we see, at least we have the satisfaction of knowing that someone is aware of it and trying to help.
But if you knew how many were, Disability Rights of West Virginia,
True.
Mountain State Justice, sometimes I don't agree with a lot. There's a lot of people out advocating, and we run into roadblocks. And my hope is that we will be able to, our little committee, and I don't want to make it that we're across anything more than what we are. We're small. But our committee will be able to identify the roadblocks, recommend possible solutions, or at least a pathway for solutions, so that we can begin to see. We're only the forensic population.
Right, right.
So we have people in the jails. We have people on waiting lists that they have to languish in the jails. We have people in the jails, the prisoners that are, or the residents, whatever, that are problematic.
But there will be an overflow. I mean, it will affect a lot of people.
We're hoping. We're hoping our little committee will be a capsule or a catalyst for some change. Who knows? We're going to try.
Good job, Dr. Klayman.
We're going to try.
Good job. On that note, we close for the day. On behalf of Dr. Klayman, I'm Sharon King, thanking you for watching the television network. Till next time, bye-bye.